Welcome, everyone. Today we're focusing on something really important for anyone looking into transcranial magnetic stimulation, TMS. It's this question: how long do the benefits actually last?
Right.
You probably know the basics of how TMS works for major depression, but once someone feels better, the big question is always, how long can I count on this?
Hmm.
Is it just a temporary fix, or can it provide like sustained relief? And just so you know, this discussion is brought to you by SEBERS Medical at blossomtms.com. So yeah, we really want to explore what the science says about TMS durability.
It's absolutely fundamental, isn't it? For
Yeah.
patients, knowing if relief will stick around offers genuine hope.
Mm.
And for us clinicians, understanding durability helps plan long-term care and, set realistic expectations.
Okay.
Basically, TMS uses these focused magnetic pulses, usually aimed at the left dorsolateral prefrontal cortex.
Right, the mood center area.
Yeah, exactly. Sort of a key control hub for mood. And these pulses, they gently stimulate specific brain circuits tied to mood regulation. What's happening over a treatment course isn't just fleeting. It actually encourages what we call neuroplastic change.
Neuroplasticity, yeah. The
Yeah,
brain rewiring itself.
precisely. It's the brain's amazing ability to reorganize, form new connections, essentially rewire its activity patterns. And it's these longer-lasting shifts that are really key to understanding why TMS can offer sustained relief, which makes that question of how long they persist just so vital.
All right, so let's unpack that there. We need more than just stories, right?
Yeah.
What do the actual clinical studies show? How long can these results hold up?
Yeah.
We've looked at some pretty compelling findings, and they seem quite encouraging, especially in real-world type settings.
Yeah.
So one really insightful study was a naturalistic one-year follow-up. It was done across multiple sites.
Mm-hmm.
And naturalistic is important here, right? Because it's watching patients in their normal clinic settings, allowing regular care like meds or other therapies, not some sterile lab.
It's exactly real-world conditions.
And what they found was, well, pretty significant. Among patients who got to full remission, like symptoms basically gone an impressive 70.5%, didn't relapse over a whole year.
70%. That's really robust, especially when you think about major depression often being chronic,
Yeah.
relaxing.
Right.
Many other treatments see much higher relapse rates within a year. So yeah, for that many fully remitted patients to hold on to that relief for 12 months, it's genuinely impactful.
It really is.
It suggests those neuroplastic changes we talked about, they can really hold for a lot of people. And what's also fascinating from that same study, 50% of those remitters stayed in remission at every single check-in point during that year.
Every single one. Wow.
Yeah, and even if you broaden it out to everyone who finished the initial treatment as either a responder or a remitter.
So responders saw improvement, even if not full remission.
Correct. Significant symptom reduction. Across that whole group, 62.5% kept their response going throughout the entire year.
These aren't just stats, are they? That represents months, maybe a year of better quality of life.
Absolutely. Regained life.
Those are powerful numbers, especially given how tough MDD can be. Now, you mentioned the naturalistic part allowed for things like continuing medications or even getting more TMS if symptoms came back.
Exactly right. And that context is just crucial.
Okay.
Because it was real world, patients could stick with their other treatments, like antidepressants, or importantly, they could opt for TMS retreatment if they felt things slipping.
So it wasn't just, okay, you're done, good luck.
Not at all. And look, that's not a study flaw. It actually mirrors how good mental health care should work. It needs to be adaptable, responsive to what the patient needs over time.
Makes sense.
It highlights that TMS isn't necessarily a one and done for everyone. It's often a powerful tool within a wider ongoing strategy. And those factors, that flexibility, undoubtedly help explain those impressive durability rates. Patients weren't just left hanging after the initial course.
That's a really key distinction. Real-world care is flexible, often uses multiple approaches. Okay, so to get an even bigger picture, let's look at a meta-analysis. A study of studies, right? Pooling data.
Yes, exactly. This one combined results from 19 different studies. It gives a slightly different angle, but still valuable. It found that among those who initially responded well, saw significant improvement. About 66.5% were still maintaining that response at 3 months.
Still pretty good, 2/3.
Very good. But as time went on, the figure did dip a bit. It went down to about 52.9% at 6 months.
Okay.
And then to 46.3% still maintaining response at the 12-month mark.
Right. So connecting these dots, durability is clearly real for many, definitely.
Mhm.
But the aggregate rates, when you lump studies together, tend to show some decline over time, which, as you said, might not be about the treatment failing, but maybe reflects the chronic nature of depression itself for some people.
That's a very important point. It reminds us that managing MDD, even with fantastic therapies like TMS, is often more of a journey.
Not just a single destination.
Exactly. That decline in the aggregate numbers, it underscores that we need ongoing vigilance, proactive strategies, not just a cure mindset. And it brings us back to context mattering, how different studies define relapse, what kind of follow-up care was allowed. That all impacts the numbers we see.
Okay, this is where it gets super interesting for people trying to figure this out for themselves or a loved one. If the numbers vary, what specific things actually influence how long someone's TMS benefits might stick around? Is it just random, or are there factors we can point to?
Oh, there are definitely identifiable factors, and knowing them helps everyone involved. One of the strongest predictors seems to be the depth of that initial response.
How well they got initially.
Exactly. Patients who reach full remission, minimal symptoms, back to their usual functioning, they tend to hold on to those benefits significantly longer than people who only had a partial response.
That makes intuitive sense, doesn't it? A stronger positive change probably means a more robust shift in those brain circuits.
Precisely, like building a really solid foundation for feeling well long term.
Okay, solid foundation first. What about ongoing support, like maintenance TMS or booster sessions? Do those regular top-ups help, or is the evidence kind of mixed?
The evidence there is, well, quite nuanced. It is pretty mixed.
Okay.
For instance, there was one key randomized controlled trial, the gold standard, right? It looked at doing TMS just once a month for maintenance, and it found no significant benefit over just watching patients closely at the 1-year point.
Oh, interesting. So a fixed monthly schedule might not be the answer for everyone.
That particular study suggests maybe not as a blanket rule. But if you look at broader reviews, they often do suggest that maintenance can help some patients. The mixed results probably come from differences in who they studied, the exact TMS methods used, how they define success or relapse across the trials. It gets complicated.
So not a one-size-fits-all for maintenance either. But you mentioned some emerging data comparing maintenance TMS to something like lithium. That sounds significant.
It really is a promising area. Some newer RCT data suggests maintenance rTMS that's a specific type might actually be comparable to lithium for preventing relapse.
Wow, compared to lithium.
Yeah. And lithium, while effective, often comes with side effects that can be tough for patients.
True.
So the idea that TMS could offer similar relapse prevention, but potentially with fewer side effects, that's a huge potential plus. It opens up options. But, and this is important, standardized protocols for maintenance aren't really set in stone yet.
Still evolving.
Right, which means a personalized approach, really tailored to the individual's response and needs, is probably the best way forward right now, not just a fixed schedule for everyone.
That really hammers home the personalized care angle. So beyond TMS itself, what about other support? Like ongoing therapy, tweaking medications, lifestyle stuff, exercise, sleep? Do those help keep the benefits going?
Oh, absolutely. We call that adjunctive care, and it's often critical for a holistic approach to staying well. Ongoing therapy helps build coping skills. Getting medications optimized is key. And yes, lifestyle factors, exercise, good sleep, nutrition, they all contribute to brain health and resilience.
Right, the whole picture.
The whole picture. Now, the evidence for specifically how much these things boost TMS durability is what we'd call heterogeneous. It varies across studies, but generally, they support a more stable mental state. And then you have individual patient factors, too. They're huge.
Like what?
Well, how severe the depression was to start with. That can play a role. Whether the patient has other conditions, comorbidities like anxiety disorders, substance use issues, chronic pain, those add complexity and can shape long-term outcomes. And frankly, how well the patient sticks with follow-up care and engages with ongoing support. That's often a major factor. It's not just about the TMS pulses.
It really sounds like a complex interplay of many things influencing that durability. So let's shift to the practical side. What does all this mean for doctors, for clinics, managing care after that initial TMS course wraps up?
Yeah, this leads to some really vital practical points for providers. Number one, it's absolutely critical to keep tracking patient outcomes after the acute phase.
Don't just stop monitoring once the main treatment ends.
Exactly. Use those standard questionnaires like the PHQ-9 or QIDSR. They're quick tools to track symptoms regularly. You want to catch any early signs of symptoms creeping back. Early detection means timely help.
Makes sense. What else?
Plan for relapse contingencies. Be upfront about it. Many good clinics allow for TMS reintroduction if symptoms return. Just like in that naturalistic study, have that plan B ready.
Okay. Proactive planning.
And regarding maintenance, use it judiciously. Think individualized schedules based on the patient's needs rather than just promising fixed monthly boosters for everyone, given that mixed RCT data.
Right. Tailor it.
Be evidence-informed, but most importantly, patient-centric.
That's super helpful practical advice for clinicians. And speaking of supporting clinics, this is probably a good spot to clarify the role of SEBERS Medical, who we mentioned earlier. They make the Blossom TMS therapy system.
Yes, and it's good to be clear about their role. What SEBERS Medical doesn't do is provide the clinical treatment themselves. They don't create patient care plans.
That's the clinician's job.
Absolutely.
Yeah.
That rests with the qualified medical teams. SEBERS Medical's role is as the equipment manufacturer and a partner to those clinics. What they do provide is a dependable, high-quality device, the Blossom system designed for both the initial acute course and any needed retreatment. They also offer really thorough training and onboarding, so clinics use the system effectively and consistently, and crucially, ongoing technical support. That ensures clinics can carry out their treatment plans smoothly without tech hiccups disrupting patient care. Reliable tech is vital.
Okay, so wrapping this up, what's the main takeaway for you, our listener? The core message seems to be that, yes, for many people, TMS benefits really can last for months, often a year or more. It offers real long-term relief.
It definitely can.
But the exact durability rates, they depend on the specific group of patients studied and, importantly, the context of their follow-up care, like access to meds or retreatment.
Right.
And while maintenance strategies might help some people, the evidence, especially for rigid monthly schedules, isn't totally consistent, which points back to needing individualized plans.
Personalized care is key.
Ultimately, it seems routine monitoring after treatment and having that option for timely retreatment if needed are really crucial for supporting sustained relief in the real world.
Perfectly put. And maybe a final thought. This whole discussion really highlights that the journey with mental health treatment, especially with newer therapies like TMS, it's often dynamic, right?
Not static.
It's not a one-time event. It really pushes us to keep thinking about personalized, ongoing care strategies. And it shows how evolving technologies and our growing understanding really empower us to provide that more adaptive, patient-focused care, meeting people where they are on their journey.
An excellent point to end on, that adaptability and personalization are paramount. And for any clinicians or clinic staff listening who want to learn more about how the Blossom TMS system can support these kinds of long-term outcome strategies, you can visit blossomtms.com. Thanks so much for joining us today.